Heidi Otway, your host for this Conversations on Cannabis live virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about using medical marijuana as a therapy for people living with HIV. So let's talk and learn about this subject with our guest. Dr. Natalie Wilson has more than 25 years of clinical expertise in primary care, HIV, and sexual health. She's an educator and a researcher on the topic with a focus on transforming healthcare for individuals and systems. Dr. Wilson, welcome to the forum. Tell us more about yourself.
Oh, hello, everyone. Thank you so much for having me. I'm an associate professor at UCSF here in the Bay Area in California. And I've been doing research on HIV symptom clusters for quite a number of years and looking at how we can mitigate symptoms, manage them, and inflammation caused by some of the mechanics of how the HIV virus works in the body.
Yeah.
I received my doctoral degrees from the University of Alabama in Birmingham and a master's degree in public health from UNC Chapel Hill and in nursing from Vanderbilt University. And I went to HBCU, Spelman College.
Yeah.
Graduating in the 1900s, late 1900s.
All right. Well, Dr. Wilson, I'm looking forward to this conversation and learning more about your expertise. To everyone joining us on this live forum, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have Dr. Wilson answer them. We also want you to tell us what you think about this forum by completing the survey posted in the comments on Facebook and YouTube after the live forum. Your name will be entered into a drawing on November 12th, 2024 to win a $100 gift card provided by one of Mary's partners. Now, let's start this conversation on cannabis. So, Dr. Wilson, HIV and AIDS, came out decades ago. So it might be good just to remind everyone that's listening and watching, what is HIV and how it affects the body?
Okay, so HIV is a type of retrovirus that when it gets into the body, it targets the host or the human's immune system.
Mm-hmm.
So it actually inserts itself into the genome or like the DNA and makes copies of itself. And as a result, it ends up destroying the immune system over time. And that's how it causes acquired immune deficiency syndrome or AIDS. And someone can be in an advanced stage of HIV or AIDS as a result of that if they do not get treatment. Mm-hmm. It also impacts, because of the immune system, it impacts the gut lining and causes like a leaky gut. And because there's no immune system which is behind the gut, there's a large amount of the immune system or the gut associated lymph tissue behind the intestines. It's not able to protect the rest of the system from microbial products from leaking through into the bloodstream. And so products can get into the bloodstream and cause the immune system that's there to get activated and cause inflammation. Yeah. So the virus is very active. We don't have a cure yet because it's hard to get into the genome to cure it.
Yeah. Yeah. Well, you referenced some of the symptoms when you were describing what it is. What are some other symptoms that people with HIV experience?
Yeah, so people living with HIV can experience many symptoms, primarily things like pain, difficulty sleeping, difficulty falling asleep, fatigue, peripheral neuropathy or burning in the hands and feet, poor appetite, gut symptoms. And we see a lot depression, anxiety, and brain fog, which I'm having a little bit of right now, brain fog that can lead to forgetfulness or just not being able to think clearly. So
Mm,
people have that neuroinflammation in the brain.
wow. So HIV is a qualifying condition for medical marijuana use here in Florida. So how does cannabis relieve some of those symptoms that you just mentioned?
Yeah, so cannabis has quite a few anti-inflammatory properties and antioxidant properties. It also interacts with the gut microbiome
Mhm.
and helps heal some of the gut. We Cannabis has several components that work, such as THC, um, cannabidiol, CBN, cannabinol, or CBG or CBDV. It has several different components that actually work together to reduce inflammation, which we see
Mhm.
in HIV
Mhm.
and in other people. People use it in cancer or other conditions.
Right, right.
And because it reduces the inflammation, that inflammation that causes the symptoms, such as pain, neuropathic pain, musculoskeletal pain,
Mhm.
arthritic pain, anxiety, depression, it can mitigate those symptoms.
Right, right. So what are the typical treatments for cannabis therapy?
What are the typical treatments?
Yeah, so if
Uh,
someone has HIV or AIDS and they're looking to use cannabis, what could their therapy look like using cannabis?
Okay, so one, I wanna be really clear that cannabis does not treat HIV.
Okay.
So yes, so HIV, you need to have antiretroviral treatment,
Okay.
and that's really important because the only way you can stop the virus from replicating itself is to take antiretrovirals, which are really easy to take. They even have injections that last 2 and now 6 months.
Wow.
So once that happens, the virus is suppressed, and
Mhm.
in terms of ending the HIV epidemic, once the virus is suppressed, you cannot spread HIV.
Oh.
Yeah, so
That's
that's a way
I
to
know
prevent.
there's been major advances since it was first came out, so thank you for sharing this. This is
Yeah,
really
I used to take a lot of pills, have a lot of side effects from pills. Now
yeah.
the treatments have very little side effects,
Mhm.
but people are still, even when virally suppressed, having ongoing inflammation,
Yeah.
which can have an impact. So it's really important. And I want to stress that cannabis will not treat the HIV, that you need antiretroviral treatment
Okay.
to treat HIV. The only thing that cannabis can mitigate is some of the symptoms that are a result of the inflammation, immune activation, or even the virus, or some treatments that you could be taking for something else. It can mitigate those symptoms.
Okay.
So
So let's talk a little bit about that. So what does that mean? How does it impact the body? And I think a lot of people are learning more about the endocannabinoid system and the role that it plays in our health. So can you kind of tie all that together for me, please?
yes, absolutely. So the endocannabinoid system is our body's natural way of cannabis, the mitigating things. And it's a network of receptors and enzymes and ligands that are in the body, and they naturally reduce inflammation. And over time, they can start to reduce. Okay. And we have in our body receptors. So we have cannabinoid receptor 1 and cannabinoid receptor 2, and they're in most tissues.
Mhm.
And they're constant. Most of the CB1 receptors are most abundant in the brain,
Mhm.
where they modulate neurotransmitter activities and mediate the effects of the phytocannabinoids or cannabis on neurobehavior.
Mhm.
And so you will find many of those in the brain. They're not found in the respiratory center, like we see in opioids,
Oh.
for example. So you're not going to get that respiratory depression.
Mhm.
Um, CB1 receptors are also found in immune, cardiac cells, and testicular cells,
Mhm.
and also in the gut.
Mhm.
All
Mhm.
right.
Yeah.
And yeah, so and then we do have expressions of CB2 to receptors as well,
Right.
which mostly, yeah, I'll leave it to that.
So how does cannabis help regulate this system, the endocannabinoid system, and then also the symptoms of HIV?
Yeah, so what it does is in those receptors, cannabis binds to those receptors and does the work that our endocannabinoids would normally do.
Okay.
Okay. So different components you heard me say, like we have THC, DBD, CBD, CBG,
Mhm.
CBN,
Mhm.
those combined to those receptors and or CBD actually doesn't bind to the receptors, but pushes THC off of the receptors, but it also has an anti-inflammatory effect.
Mhm.
They have an effect or on the pro-inflammatory, uh, let's see, they have an effect on anti-inflammation,
Okay.
basically.
Mhm.
So they interact with certain cytokines to reduce them.
Okay.
Sorry, I hope that was clear.
No,
They reduce the inflammation.
right, and yeah, that's the core
To
is what
get
I'm hearing
technical.
is that because you said that's one of the symptoms of HIV. So I know that you've done some studies on cannabis therapy for people who are living with HIV. Can you talk a little bit about the studies and what you've learned and what prompted your interest in this subject altogether?
Yeah. So what prompted my interest in working with cannabis is I was doing studies on symptoms and looking at what symptoms could be associated with microbial translocation and which is the translocation of the microbes from the gut into the bloodstream that we talked about earlier, and
Mhm.
that happens through the leaky gut. When those tight gap junctions are destroyed by inflammation,
Mhm.
and you don't have the cells to produce the cytokine that kind of repairs them,
Mhm.
in the body naturally.
Yeah.
And so cannabis, uh, we were looking at, excuse me, I was looking at symptoms, and we discovered that people had poor appetite, and then that those people that reported poor appetite had higher levels of soluble CD14, which is an indicator of this microbial translocation. And
Mhm.
so I decided to interview those people that were living with HIV and
Mhm.
had reported poor appetite. And many of them said, "What I do is I smoke cannabis to eat." Because back during that time, many of the medications required food to take. And of course, if you don't have an appetite, you don't want to eat, and you need to eat to take your medications.
Right.
So, because I I heard that that's what they were doing, I decided to look more into the impact of cannabis on poor appetite, and then
Mhm.
discovered that there were shifts in the microbiome as well.
Hmm.
So that's what I started looking at. Now, in terms of research, I published a few reviews that looked at animal studies,
Mhm.
and um, the possibility of using cannabis for some of these symptoms and where we could position it with symptom management. However, it's difficult to study cannabis because the cannabis binds to your endocannabinoid system, and so we're all different.
Yeah.
And I like to say, if we studied, cannabis, we would need a dosage. That's how the medical system and research works. We need a dosage. And say my dosage may be a little less than, say, Snoop Dogg's dosage
Right. His would be
to
like,
produce the
oh,
impact. It's
right.
going to have a different impact on people. And there are various ways and routes that you could take cannabis as well. So
Yeah.
inhalation,
Yeah, let's talk
you
about that. Yeah.
yeah, yeah, you have inhalation, which takes effect pretty rapidly
Mhm.
within
Mhm. Mhm.
seconds to minutes.
Yeah.
And then you have ingestion of cannabis. You can do tinctures under the tongue.
Yeah.
You can have edibles.
Mhm.
And then you can use, and that takes like about, it could be anywhere from like 40 minutes to 180 minutes for that to take effect. So
Right.
people need to be really careful when they're saying this isn't working. And then don't take more, just give it some time. And
Mhm.
then you have topicals as well. And they have other like waxes, other ways of taking like dabbing.
What? I hadn't heard of a wax. Tell me about
Yeah,
that.
like it's dabbing. It's just like a wax and people
Uh-huh.
just dab it. I mean,
Re
there are many ways you can get cannabis.
Yeah.
Um, and it depends on the impact and how quickly you need it.
Yeah, yeah,
Uh,
and then here in Florida, you're required to go to first, HIV is a qualifying condition here in Florida, but you also need to go to a qualified physician who can help that individual determine what's the best type, and then also what's the best way to get it into the system. So we want to encourage people to remember that. Uh,
yeah, you'll
or
wanna yeah, you'll wanna talk to the bud tender about specifically what your needs are and ask for recommendations, and usually they're pretty good about supporting you if you're new to cannabis.
Mhm,
And looking up what would be right for you. You know, like my mother, I had her, she was having difficulty sleeping, and I sent her CBN, like some cannabis to help her sleep. And that
mhm,
has a very sedating property. And
mhm.
so those were in edibles, like in lozenges or uh, little gummies.
Yeah, yeah.
And, because she had a lung condition, she can't smoke, you know.
Right,
Um,
right.
and you wanna also consider, maybe topicals as well, because
Mhm,
that can absorb into the skin,
mhm.
um, and provide some pain relief.
Yeah, yeah. So you mentioned, your mother's experience and you've done a lot of studies. Can you share any success stories or testimonials from people who are living with HIV who found symptom relief by using medical cannabis?
Yeah, I mean, many of the people that, are living with HIV that use cannabis, they use it for pain, um, uh depending on who they are, whether I recommend them vaping or smoking, just because it goes into the lung system. But
Mhm,
I think, it is fine to um, use cannabis. You can get some pain relief almost immediately.
yeah.
Um, I think it's great as an adjunct therapy for taking your medications or for side effects of medications. Some people use it for anti-nausea.
Mhm,
However, if you get intoxicated and have too much, it will cause nausea.
mhm, mhm.
And that can be mitigated by some CBD, like pure CBD
Yeah.
or a
So,
hot shower.
a hot shower. Oh,
Hot shower.
that's the first. That's the first time
Yeah.
I heard of that one. So
Yeah, if you really start getting really sick, you can take a hot shower and it'll kind of like, mitigate that.
very interesting. So, what advice would you give someone who's been recently diagnosed with HIV and they're considering cannabis as part of their symptom management?
So one, make sure you're on antiretroviral therapy. That'd be the first, and one that works for you.
Mhm,
Um, Two, I would look at what symptoms you're having and focus on what strains would be best for you. So the sativa strain has more of a euphoric, it has more THC in it. So it has more of a euphoric, energetic uh, side effect. I
mhm,
would call it side effect to it. And I want to say, as I say that, you do not have to get high on cannabis. You don't have to get that euphoria. You can take one puff, two puffs, and it is adding that phytocannabinoid, those components into your body.
mhm,
So you can just do what you need to do, and it doesn't have to alter anything. They also have an indica strain, which is more of the relaxation, people associated with being stoned. You're going to come down
yeah,
on that strain. And then they have hybrids. and they have a sativa hybrid, which you can get some of the impacts of a sativa, which is brightening, euphoric,
Mhm.
and you can also kind of come down. So if you want to wake up, but you need to go to work, so you don't need to be totally happy
Yeah.
and all over the place. And then you have indica um, blends where you don't want to fall asleep, but you need to really kind of calm down. Say if you had anxiety,
Yeah.
like, and you need to come down, it'll have that impact, but you need to stay awake, and it'll have a little bit of sativa in it.
Mhm,
So that
mhm.
type of hybrid. So your bud tender or a expert in cannabis for medical can make recommendations for that. And then also there's a website leafly.com that
Mhm,
was really great about you putting in like your symptoms and
mhm.
it making recommendations for you because the names are all over the place, you
Yeah,
know,
yeah, yeah.
for you have so many names that people come up with, and I don't know how they come up with those names. That's a whole study in and of itself.
Right,
But,
right.
yeah, yeah, you could just go on there and it will give you recommendations and sometimes where you can, purchase, those.
Yeah.
And then, weed maps as well. So you can just type in your area and
Mhm.
it'll tell you how to get your card,
Yeah.
and where to get,
Awesome.
cannabis.
Mentioning, yeah. And I just want to take a minute to remind everyone that they can also visit the Florida Department of Health's Office of Medical Marijuana Use, where you can actually learn how to get a legal medical marijuana card and also identify the qualified physicians that are in your area that can support you if you with cannabis therapy. So just wanted to throw that out there. Dr. Wilson, this has been a really rich conversation and I've learned a lot. And I wanted to know, is there anything else that you want to share with our viewers and listeners as they're considering, not only for themselves, but maybe a loved one or a family member or a friend who may be living with HIV or newly diagnosed and just, want to know, is this something that they should consider?
Yeah, I mean, one of the things that's coming up for me is you wanna be really careful if you're under the age of 26 and selecting, cannabis. You don't wanna do too much because you do have endocannabinoids likely in your body, and,
Mhm,
you may have been diagnosed with HIV, and you can, get on treatment. Um, but cannabis is a stabilizing drug. It stabilizes things, and so if you're still in brain development,
mhm,
using cannabis on a regular basis will stabilize the growth of brain. So, you wanna be really careful with using it, and it doesn't mean that you can't get benefits, like anti-inflammatory benefits, like, cannabis is used for seizures, CBD, mostly is used
mhm,
for seizures, so that's helpful, and that's probably where I would make recommendations if you had to use cannabis, but I would stay away from, really activating those CB1 receptors with
mhm.
cannabis.
Yeah. Are there any other risks that people should consider? I mean, I thought what you just brought up was very eye-opening. Any other risks that people should be considering if they use cannabis? I mean, we haven't even delved into whether or not for some that are listening in states where recreational is allowed, what are your
Mhm.
thoughts about using, non-medical grade cannabis that, folks are buying, not necessarily in a dispensary?
Yeah, yeah, I think, eh, I think any street level drugs, like buying things off the streets are, you know, uh, I don't have as much trust with that. Usually when you're getting it from a dispensary,
Yeah.
it's regulated.
Heavily regulated.
Yeah, heavily regulated and you know what you're getting.
Yeah.
And I know you guys are going through Amendment 3. I think that the recreational use allows for access to get cannabis safely
Mhm.
for people. So I think that that's definitely helpful and it's regulated.
Yeah.
Like you know what you're getting.
Yeah.
Um, so yeah, I would just uh, I think it's just being careful. I think it's great if that does pass for you all, because it decriminalizes cannabis, and people can start using it effectively as opposed to just, you know, getting getting high. And
Yeah.
then being responsible with cannabis. It is a superfood, but you don't want to misuse it. Because it does have an impact on your body.
Yeah, yeah. And so again, just reminding people here in Florida, make sure that you go to a qualified physician again so that you have a good experience if you
Yes.
choose to use medical cannabis as a therapy for HIV. So,
Yeah.
Dr. Nally, before we wrap up, any closing comments you want to share with our listeners and viewers? This has been a very informative and rich conversation. So, thank you.
No, if I think of anything with the questions, I will. I think it's wonderful on inflammation, um, which is its job, and it's very effective at managing symptoms. And people living with HIV do have symptoms,
Yeah.
and you just got to be really careful.
Yeah. All right. Well, Dr. Wilson, thank you so much for being a guest on our Conversations on Cannabis live virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. Thank you to everyone watching this program. Tell us what you think about this forum by completing the survey posted in the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on November 12th, 2024 to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. We also encourage you to go to Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thanks, everyone.